We all know about folks with chronic pain. We know it's prevalent. What isn't always appreciated is the significant percentage of those folks who have a history of trauma, PTSD, trauma symptoms, and all kinds of changes and behavioral and mental and physical changes secondary to that. And what has begun, I think, as in social work, but then spread throughout lots of different areas, is to take those concepts of how do you deal with folks who have bad trauma and apply them in the realm of chronic pain. Because the patients that I'm talking about are going to present differently. They may have more extreme problems, they may have different problems, they may be more recalcitrant to treatment. And so by utilizing these principles of trauma-informed care and applying it to these patients, you have a better chance of having success. That comes out of the definition of trauma, which is, depending on whose definition you read, a deeply distressing emotional experience that overwhelms the nervous system. Basically means is so distressing to a person, is so upsetting that they will develop changes which are there are neurological changes that occur, and what happens, if you want me to expound a little bit, when people are traumatized, they get an increase in the area of the brain called the limbic lobes, which is actually a collection of different centers and different structures, but we call it the limbic area. And this is your old embryologically and developmentally area. This is your reptilian part of the brain, the part of the brain that reacts to a threat and gets you out of there. So it's the same part of the brain that a lizard would get it out of danger. And we still have those parts. And so we're normally trying to function, and that's not coming into play much. But if people get traumatized, that area gets activated, and it surrounds the hypothalamus, which then directs the pituitary gland. And we tend to get high levels of cortisol, catecholamines, and that causes some neurostructural changes. And over time, those changes lead to behavioral changes, all the things that we see associated with PTSD, intrusive thoughts, avoidant behavior, negative self-beliefs. And all of those things are being carried around by the patient, whether they know it or not, whether they even appreciate they've been traumatized or not. And they come into us, and they're coming into us, not because they're traumatized, they're coming into us because they have chronic pain. They're hurting somewhere. And not only are they hurting, they're suffering. And so they present to us, and that question that you asked me, an inescapable event that affects the nervous system, that's what it's talking about.